Nalgeria fowleri is an amphizoic amoeba, which may live freely in soil, water, or even inside its host, the human central nervous system. Nalgeria fowleri is a thermophilic and free-living organism. It is the only species of Nalgeria known to infect humans. The life cycle of Nalgeria fowleri consists of three stages: cysts, tropheocytes, and flagellated forms. Promitosis is the process by which tropheocytes multiply, and tropheocytes can briefly change into flagellated and non-feeding forms, but they often return to the tropheocyte stage. Tropheocytes enter the nasal mucosa of people or animals by either swimming or sinus irrigation, and then they migrate via the olfactory nerves to the brain, where they cause PAM. The symptoms of Nalgeria fowleri infection can resemble those of meningitis caused by bacteria. Nalgeria fowleri infection typically presents 2 to 8 days after infectivity, with typical symptoms including photophobia, confusion, seizures, severe headaches, fever, chills, positive Brzezinski, and Karnik signs followed by coma. In some cases, myocardial necrosis and irregular heart rhythms may also be noted. High intracranial pressures and cerebrospinal fluids have also been attributed to the mortalities, with patients experiencing CSF pressures in excess of 600 millimeters of water. CSF analysis reveals color abnormalities, with gray in earlier stages and red in later stages. Higher numbers of polymorphonuclear cells and tropheocytes are also observed. Abnormalities in MRI are frequently detected in the brain's subarachnoid space and midbrain. Nalgeria fowleri infections are uncommon and mostly happen in the summer months of July, August, and September. Infections have been reported as far north as Minnesota, primarily in southern tier states. There isn't enough information to calculate the real risk of PAM. Infection rates range from 0 to 8 per 100,000 visitors to the swimming facilities that occur naturally in the United States. Why some people can contract the amoebae, but millions of others exposed to the warm recreational fresh waters do not, even those who swam with those who had contracted the amoebae, is unknown. Nalgeria fowleri infection risk is quite low nonetheless. Despite hundreds of millions of exposures on recreational water every year, there have only been 29 cases recorded during the U.S. over the past 10 years, from 2013 to 2022. There have also been no distinct geographical or gender-based epidemiology information available due to the low number of cases. Nalgeria fowleri enters the human body through the nose, attaching to the nasal mucosa and traveling through the olfactory nerve into the cribriform plate. It activates the innate immune system, activating neutrophils and macrophages. As tropheocytes and fowleri can infect bacteria, fungi, and human tissue through food cup structures on their surface. The pathogenicity of N. fowleri depends on the production of cytolytic chemicals such as acid hydrolases, phospholipases, neuraminidase, and phospholytic enzymes, which cause host cell nerve damage and tissue destruction. The pathogenicity of N. fowleri combined with a strong immunological response it elicits often causes severe damage to the nerves and subsequent CNS destruction, both of which are very fatal. The onset of symptoms typically is 5 days following a swim or further nasal contact into water contaminated with Nalgeria. Individuals typically pass away in 1 to 18 days, with a median of 5 days after onset of symptoms. In most cases, or 97%, the prognosis is fatal. The two most recent incidents in the US both happened in 2013. In both cases, the treatment was amoxicillin B, intravenously and intracathecally administered. Miltefosine, fluconazole, rofeminine, and dexamethasone, along with amphotericin, were the first medications given to the patient on the day that she arrived in the emergency room. In order to reduce brain swelling, hypothermia was also induced as part of her therapy. After the therapy, the patient fully recovered. A recent study on Nalgeria fowleri has found that pathogens' low susceptibility to existing drug regimens, particularly in combination therapy, contributes to its high mortality. Researchers have explored protein synthesis and crystallography-based structural determination for potential therapeutic targets for the virus. The Seattle Structural Genomics Center of Infectious Disease, or SSGCIDE pipeline, has created 89 soluble recombinant proteins and 19 distinct target structures, with structural discrepancies between novel protein structures and human homologs, making them viable therapeutic targets. 4 of the 5 structures show promise for active site-specific inhibitors.